Hello and welcome to Unit 4 of this module on disease outbreak response. In this fourth unit of the module, we'll be looking at risk communication during an outbreak response. So what is risk communication? Risk communication is a two-way real-time exchange of information, perceptions, and advice among risk assessors, risk managers, and various groups. It is a multidisciplinary approach that uses a mix of communication and engagement tactics. For example, media communication, mass awareness, and community engagement. So risk communication is a very important task that is a huge core public health intervention in any response to disease outbreaks, in pandemics and other health emergencies. So here, we see the flow of risk communication from information and engagement to decision and action. So what are the components of risk communication during outbreaks? We have health education, social mobilization, community engagement, media and social media, outbreak communication, crisis communication, information, education, and communication, behavior change communication, rumor monitoring and management, and of course, advocacy. What is the importance of effective risk communication? Risk communication is important during outbreaks because it allows people most at risk to understand and adopt protective behaviors during an outbreak. And it facilitates heightened surveillance, reduces confusion, and minimizes miscommunication, falsehoods, and rumors. It also allows for better use of resources. What's the target audience for risk communication? Target audience includes the community as a whole, including all people at risk of acquiring the disease or in need of health services and within the context of the outbreak. Our target audience also includes healthcare providers and first responders, hospital and clinic staff, surveillance officers, laboratory staff, points of entry staff, airline staff, and immigration officers, travelers, primary caregivers, stakeholders, including policy makers, departments of health, maternal and child health organizations, community organizations, and so on. The media too is involved because they are going to serve as a channel to reach the audience and also involve their schools and workplaces. And so, what are the 5 principles of risk communications? They include timely announcements and transparency, creating and maintaining trust, listening to, understanding and respecting public concerns, and planning, as well as ensuring equity. So here we see a diagram that depicts the integrated approach for emergency risk communication. The first component there is risk communication systems. And this includes strategies, plans, standard operating procedures, structures, resources, and simulation exercises to test the systems that you have. We also have internal and partner communication and coordination, which includes mechanisms at local, state, national, and international levels with stakeholders such as healthcare providers and non-governmental organizations, volunteers, civil society, and so on. And then there is public communication, which includes the media, social media, and the web, and social mobilization, and so on. And then there's communication engagement with affected communities, directly or through influencers, including awareness campaigns, community radio, interpersonal communication, using the existing community engagement mechanisms. And then the 5th component is dynamic listening and rumor management. So the media and social media surveillance comes in here, partner, stakeholder, and community feedback, emergency anthropology, and social knowledge, attitude, and practices, and other social science tools also are involved. So this is the logic model for risk communication, starting with public information, mass mobilization and engagement. And the output, expected output, should be trusted information reaching the people and all rumors being dealt with and addressed. And then your outcome will be that everyone at risk being able to take make informed decisions and mitigate the effects of the threats into their lives. And lastly, the impact of the risk communication should be reduced deaths, illnesses, and economic losses from the outbreak. So how do we select the best risk communication strategy? There are 3 steps involved, and these include assessing the risk, gauging the risk perception of those at risk or those affected, and then finally selecting one of the 4 communication strategies based on these assessments and gauging of the risk. And so we assess risk by asking a couple of questions. We want to know how big or small the threats or hazard is. We want to know how imminent that threat is. Is it going to happen now or in the future? And we want to know the levels of exposure and the vulnerability of the population as against their capacity to deal with the threat. And of course, we want to ascertain the availability of resources and to contain that threat. Next, we'll gauge the risk perception of those who are at risk or those who are affected by the threat. And so for experts, healthcare professionals or public health experts, threat is assessed by the level of morbidity, mortality, disability, and losses emanating from the threat. But this is not so with the general population, and because public perceptions of risk differ from that of experts, and people in the population are generally less concerned about health risks that are voluntary, that are familiar, controllable, that are chronic, diffuse, or non-fatal. And they are only concerned, they're only seem more worried or outraged when these health risks are involuntary, unfamiliar, as we saw in the case of COVID-19, which was something different, and uncontrollable and unfair or acute and focused in time and space. And of course, when there are high fatalities, people become worried in such situations. And so we have to bear all these factors in mind in being able to tailor our risk communication strategies to meet the needs of the situation. Often people generally are not that logical, and their actions and behaviors are influenced by their emotions and their culture, and their perceptions are rooted in their subconscious. So these factors have to be considered, have to be taken into cognizance when carrying out risk communication during an outbreak. So there are 4 strategies for risk communication, depending on the assessed level of threats and how large or small the threat is, and where in the spectrum between apathy and outrage the population tends to fall as regards their perception of that threat. So based on these locations, we can have 4 strategies, including outreach management, crisis communication, health education and stakeholder relation, and precautionary advocacy. So the first strategy is that of precautionary advocacy. Here, there is indeed a large threat, a large hazard, but the perception of the population is such that there is less concern and laxity, so to speak, and apathy. So here, the goal is to outrage them to our own level of concern so that they can take action to protect themselves from the imminent danger. And that will mean arousing their emotions, because we want them to be able to prevent crisis that is at hand. Yeah. Next is outreach management. Here is a situation where there is indeed a small threat, but there are high levels of fear and concern and outrage in the public. And so the goal of risk communication will be to listen and acknowledge truth and give facts about why there is not much danger, to get to calm the nerves of the populace, or the public, or the population, and get them to feel more relaxed. The third strategy is that of crisis communication. And this we need in a situation where there is indeed a huge threat and it is matched by high levels of outrage and fear as in terms of perception of the population. And that will entail explaining what is happening and doing what we can to contain the emotions of the people and get them to have a sense of belonging and a sense of protection and a sense of being together, and an idea that health authorities are doing their best to get things under control. And then the fourth strategy is that of health education and stakeholder relation, which is needed when there is a small threat and, of course, low levels of concern and in terms of perception of the population. So here, what we need to do is communication surveillance and trying to identify and address outreach early on. So in summary, remember the four steps, the following steps, which is steps 1 and 2 to decide which strategy to use. And then you review your analysis frequently as the situation evolves and change your strategy as needed. And then you select one of the 4 risk communication strategies depending on the results of your steps 1 and 2, which was assessing the level of threats and hazards, and then gauging the perception of the population. Building and maintaining trust is the most important function of effective communication. And risk communication and risk communication activities in public health emergencies such as outbreaks should include participation of the population. And early and regular communication of advice and guidance is the most important public health tool in managing the risk. Thank you very much.